we're gonna make all the decisions for the other guys. Um, so let me start to open up here. Call to order. So the Community Engagement and Collaboration Subcommittee meeting has now commenced. It is May 28th at 1 p.m. We ask, or shortly after 1:06 p.m. We ask all commissioners and guests to mute yourselves until called upon to speak to avoid feedback and background noise. For those who have dialed in using the call-in number to unmute speak, dial *6 on your phone. Also, prior to speaking, please announce who you are to identify yourself. As a reminder, this meeting is being recorded. We ask that you only use the chat function to request to speak or to announce that you're leaving the meeting so that we can track quorum. Also, to comply with the state open meeting law, attendance and votes will be done by way of a roll call using audio, not by using the chat function. Okay, roll call. This will be quick. Robert Ojeda, Michael Edmonds, Mindy Bernstein.
Here.
Kenny Wong.
Here.
And Miski here. Wonderful. Okay, I am going to jump into the agenda for today. And as I pull up again, I'm traveling, so my technology is a little strained today. I also do again want to apologize to everybody. I was telling Neto that with my lung issues, my blood oxygen was really low, and I discovered that I was just completely spaced out for a couple of weeks there. So I'm so sorry. Hopefully this will not happen again.
Hopefully you're feeling better.
Yeah, I'm getting, it's taking a lot longer. I was saying the joys of getting older, things just don't leave as quickly as they used to, but I'm back on my feet, fortunately. So thank you.
Did you have a pneumonia vaccine?
No, but let me tell you, next fall, it's going to be the vaccines for sure. Yeah. Yep. Live and learn after the fact. So unfortunately, I don't have a report on the county collaboration. That's on me again, but I do have a brief one about the city. I've been corresponding with Jay, and he spoke to the mayor, and she has asked that there are some commission representatives whenever there is a discussion or a vote in council on anything to do with housing or housing development or homelessness or housing development. We can certainly coordinate with the other committee, but I was saying before you folks came on that I do think it would be a great idea if we get a regular list of all things coming up at council and events in the city. We have a calendar, and then certainly this committee, but also the other committee, the commission itself. I think it would be really great if we could kind of divvy up and try to ensure that at least one representative goes to any of these important things to really show our support. So if people are okay with that, we can, work with Neto and Jay or whatever and make sure that we start really tracking all of the things that are going on and then get people to kind of sign up for things. I know I've been remiss, but everything that's come up lately, I've had a conflict. So if we can kind of move it to the whole commission, I think that would be great if people are okay with that. So I thought we would just spend a couple of minutes talking about the materials that I sent. It's not to try to impose on anybody. I just thought, based on the discussions we'd had, I just did, pull together some things on the different areas to help guide us in terms of, we talked about, for example, populations, we talked about myths. There's a lot for a small committee. So by having that, I thought it might help us. Do we want to focus on one or two areas, at least to begin with, and move on? But I'd love to hear anybody's thoughts or comments or questions or disagreements with any of the materials.
You can start, Kenny. And I don't think, is it okay that we not have our microphones? Like, can we not raise our hands and
I
meeting
don't think we need to do that because there's only three of us, so I think just speak
have a
freely.
conversation. Yeah.
Yeah.
Yeah, but thanks for pulling a lot of material together. No reservations or, no qualms about like the especially that myth busting document. I think there are a lot of yeah, preconceptions or really hard narratives to reshape around, the reality that people are seeing and what the causes of those situations might be.
Yeah. Mindy, any thoughts from you?
I did not thoroughly read all the notes.
That's quite all right. It was a lot of material.
Well, there's been a lot of chaos in my life. I want to wish I could pull it up so I could relook at it. There was one when I did look at it, and I don't remember which one it was at the moment, that I was kind of wondering, how are we going to achieve educating the community? And that's all I remember. I have to relook at everything.
No, that's quite all right. So, in fact, why don't we kind of launch into community um, focus, community engagement? Because I agree with you. We are a small group of people, and this is a massive task ahead of us. So, again, thinking today about narrowing down what is doable for us as a committee. I got the feeling from our discussions prior that that community education engagement piece people felt was probably the most important. Um, Not that they're not all areas of importance, but that this is something this committee can do. I will say I did have a conversation with an agency here in town, and full disclosure, they've asked me to be on their advisory council. Um,
Good.
but they were really interested in working to the in the on the with the commission even before I told them that I was on the commission, and they were like, "Oh, we've been meaning to get in touch." They seem really excited about that community education engagement piece. They just launched a podcast. It's Compass Affordable Housing, and one of the things I am wondering, because again, I don't think we have the bandwidth to do a lot, but maybe one of the things we could do is have conversations with the number of agencies, as well as obviously the city and the county, that are working on these things. And maybe our role could be more as a catalyst than necessarily the ones doing the work. Is there opportunities? Like I said, they have a podcast. How could we partner with them to say, here are three areas we would really like to highlight, speak to other agencies, speak to United Way, community, other groups that are doing this, Primavera, for example. And how do we coordinate? Because a lot of people are doing great work. And I'm just wondering if our role, like I say, I'm sorry. Sorry.
No apologies for bodily functions that are necessary.
Yeah. I'm going to be drinking here too, not alcohol, just something to keep my throat from getting dry. I don't know. What do you folks think about that idea?
I agree. I I think that we would have there would be more of it would be more efficient and effective if that topic of community engagement and education be taken on by um, other stakeholders in the community.
Mm-hmm.
That would be including mayor and council.
Mm-hmm.
And so, because the commission started as an advisory board, an advisory commission to
Mm-hmm.
advise mayor and council of what we feel would be effective in helping tackle our homelessness crisis. So I love that Compass is doing that. I would also suggest that we, or you, because you're right, I don't, that uh, mayor and council take it on as part of their uh, work, like have them, or, besides, so there's mayor and council, Compass is a great one. Old Pueblo Community, Primavera, like all of the people, all the providers who are involved in homelessness. And,
Mhm.
I also think that the behavioral health homes, if
Mhm.
that's it, and Arizona Complete Healthcare is the entity that the state gave money to provide all of these services in our community. And part of our downfall, oh, I didn't say that. I'm being recorded. I'm, I don't work for them. I'm not involved, but yeah, it's a defunding throughout the nation of indigent care services. It's become unpopular, and the end result is people are not able to get into or continue getting the services and supports that they really deserve and are entitled to and require to stay, to stay stable psychiatrically and sober and clean. So we're lacking the
You,
resources.
I think that's such an excellent point, Mindy. Thank you. And just as an aside, and maybe we can parking lot this for a few moments, when we're talking about the advocacy piece here, that might be a major issue to take on for advocacy because behavioral health, I mean, all of those things are so essential for this population. And you're right, defunding. So, is there something we can advise council on or do really around that? Might be a key area. So let's parking lot that till we come to the sort of advocacy piece. But I love that idea. Kenny, what are any thoughts on your part on this?
I yeah, I had a thought and it just slipped my mind. I think it's great to partner and again just catalyze and be engaged with especially our service providers and the folks um like directly engaged
Mhm.
finding ways to support that um and yeah, this idea of the podcast too, finding a way to participate with that.
Mhm.
I know there's a pretty clear line of communication with a lot of the service providers and our mayor and council and staff and agency. So I'm also wondering, are there ways that we might encourage like the public folks engaged in more neighborhood support to come share some thoughts, even if it's just in the subcommittee. I'd be interested in, how we can work across different organizations to, yeah, just build a stronger vision of, what are some of the gaps? How are folks stepping in to fill those in? And, there might be some pretty clear, like, tension points already, but I'm sort of hopeful that the commission or the subcommittee too can be somewhat of a bridge between work that's just got to happen. So folks have food and support, and how even business owners and stuff are navigating those things with the spirit
Mhm.
of like you know um, we want to be a part of a supportive vision too. Um, we we know path particular like pathways work, and we definitely need to be supporting those. um and at the same time, it doesn't work for every individual or in every case.
I think you definitely a really great point that go beyond just the service providers who obviously play a vital role and many the behavioral health folks. Um, I've attended a number of meetings in Tucson that have brought a lot of providers together. And obviously, the big focus right now is funding because of all the massive cuts, funding, and also a return to criminalization, stigmatization, all of those things. I feel like our role working with providers and these others is again really the awareness, understanding, engagement piece versus the how do we work together as service providers, the continuum, housing, all of those folks. I'm not saying that housing may not be something we want to really talk about and advocate for or inform people. What is the cause of homelessness? Guess what? But I am wondering, and I don't know, it'd be interesting to talk to folks at the city and county specifically on this, which I honestly haven't done, is a communications plan. So this is not about your funding. This is not about all of those other service aspects, which you guys know you're doing, et cetera. How can we at the commission help support a broad-based community understanding and awareness campaign, if you will, and bringing these people on? So, you were talking about the business community. I had some great conversations with folks at the chamber and also with SALC, Southern Arizona Leadership Council, who were really interested in finding out more about the cause and what we can do about it. So if we can start having conversations or maybe even bring a few people together to kind of headline a conversation around this, talk to the city, the county, say, and there may be possibility that we could approach a funder for a grant to help do community-wide education. I'm thinking there's some big funders that do work with the U of A or et cetera, something like that. Again, not that we're doing it, but bringing together and say, how could we create and bring all of these other groups that aren't already vested and understand, but who don't. Neighborhood associations, they can be the most brutal to work with. I've worked with neighborhood councils. Sometimes sticking pins in my eyeball would be preferable. They play an important function. Again, maybe that should be taken out of the minutes. So if we were to put together sort of a general plan to reach out around communications, and start meeting, sort of identify the various folks we want to meet with and facilitate either one-on-one conversations where people on this committee might have connections already, or we could do an invitation to meet with small groups and talk about the communication thing. Are we trying to take on too much by doing that? What do you folks think?
I think the issue is I think it's a different issue. I think that that it's pressure to get the state to increase funding for programs to support people maintain their recovery or get into recovery. That's just having conversations with people. And maybe it's about getting people to vote, or it's like everything a little unfiltered, more unfiltered than usual today. And I really, the bottom line for me is people are very aware of people that are unhoused. Maybe they don't know it's because there's a lack of funding. But is that the general public? Because every homeless person has a family attached to them, or most people have a family attached to them that know about homelessness and know about the reasons and are helpless because there's no resources. TPD, back in the day when I was a clinical worker on an ACT team, this is before SAMHSA ruined it, that we petitioned people into involuntary treatment, which is controversial now. And what we had was, after I would petition, the person would get stable, both from substance use, and then we also had 18 months residential. And we had so many robust programs that after petitioning a person so many times, the conversation was, this is a choice that when you stop taking your meds, this is how your brain starts to perceive the world and how your behavior is a result of that. And if you could accept taking your medication, you won't need to be petitioned or back in the hospital again. But these are conversations that I would have with people for years. And by the end of my 5 years on the team, no hospitalizations, no expensive residential. I was the first person to bring someone to Voc Rehab for services with a psychiatric diagnosis. And then they opened. So I think that there's more of that core issue for me of impacting how do we get the state to put pressure on the feds, or how does the state choose to spend their money on providing services and supports for people? Why is not the marijuana tax money going into substance use?
Yeah. Well, I totally don't disagree with you.
So it's hard.
But my feeling is that the community education, again, I wouldn't call it that publicly, but that actually leads to more funding. Because what we have is a situation where the myths and the growing rhetoric that people do it to themselves, they choose to be this, they want to be homeless, they're all from somewhere, all of those ones that are listed, allow governments to not do the right thing and not fund the right things. So if you can create a new narrative that is a true narrative, that is more effective for funding. Now, it may not be overnight, but in the long run, I think we saw that with the Housing First movement and how it really advanced dramatically, and we saw reductions in homelessness. And it was because there was research and evidence and a lot of community engagement. Then you get a government who doesn't believe it, cuts everything, homelessness grows, and then people immediately say, well, see, Housing First didn't work. Or whatever, behavioral health support doesn't work because there's more people homeless. Well, there's more people homeless because they cut off funding, they're not developing housing, all this stuff we know, right? So I think the advocacy piece is where we may take that on. I think the community education piece can change hearts and minds, that can enable people to vote, to pressure their elected officials. If you get somebody like the chamber behind you, that can be more effective than going and talking one-on-one with your local elected official. It's those kinds of things that I'm thinking, and it's not an easy or a quick thing at all. Anyway, I'll shut up. I talk too much. Kenny, I don't know. Any thoughts on your end?
I think that it's it sounds great, and I think you know uh yeah, just important to have our kind of our perspectives in the mix too. And I think that all makes a lot of sense. Um, uh, yeah, I guess I'm a little bit jumbled too.
I know we've taken on a lot, and so trying to make it a little
Yeah.
more concise.
No, getting back to what now I remember what you were bringing up. Yeah, I think taking on like a something that's separate from the funding feels important, right? The kind of building some ground support around it. And I think, in my mind, that probably takes some time and just some smaller conversations too. Even if that's, like reaching out to a couple of groups between now and the next subcommittee meeting, having conversation, whether it's about what are some of the ways that you could help bust some of these myths with us, right? Starting the conversation from there that might go into such a campaign.
Mhm.
Um, and then starting to build, with all of our voices, or the folks that we've talked to, um, what the outlines of a vision might be, right? That okay, we're all going to come at it from different, sectors or things that we're doing day to day.
Mhm.
Um, but what's going to be one of the positive visions that we could imagine working towards together? What are some of the ways in describing, or talking about, or envisioning together that yeah, that might get us excited, that's a little bit outside of just the monthly whiplash of like where funding is coming from. um
Sorry, yeah, no, I appreciate that. You
Yeah.
know what I'm wondering, I like when you said, start having small conversations. If we were to reach out to some of these folks and we could identify, the first 6 groups or whatever, have some of these conversations, and I'm thinking about the myths and picking some of the myths that we want to start working on, and then talk to organizations and then bring them in for their expertise. Also, because we talked about highlighting good work. So you can marry kind of the myth debunking with and here's what is, here's what the experts say, whether they're service providers, researchers, whatever. And here's what's happening in Tucson that's really great, and we've seen results from it. Or here's what's happening nationally. And here are 3 things you can do about it, which is the advocacy piece. So we could kind of marry, and again, this is just a running thought that popped into my head, but maybe this committee can say, let's choose 3 myths that we'd like to target. Who are the best organizations, people we can talk to? Again, marry the best practice, what's working, with what is the myth, bring in experts to talk about why that isn't true. Um, Highlight a few things that are happening around that, Tucson, nationally. And then again, what can you do about it, which becomes the advocacy piece. So we're kind of marrying everything we talked about under some doable pieces.
I have some thoughts. Now that I got my my thought off my head, I'm thinking that perhaps I had a few thoughts while you were talking, that we create a flyer and sort of like a statement flyer or statement piece where all of this can be written down, and can ask or request that neighborhood associations put it in their neighborhood newsletter, or neighborhood associations do occasionally do mailing with the nonprofit amount that and about because I think if we have it all written down in a very concrete way, then the messaging is consistent and can be more easily shared than having it, and then moving back, still having. And we did have a big community forum here in Tucson, a couple that I remember. NAMI put one on,
Mhm.
and that took place, I think, at the U of A, the Centennial Hall, question and answer. And then more recently, there was a forum at the Fox Theater where there were panelists. But that, again, having the panelists in the community having some conversation and time for that. But I would suggest creating a document as a.
If not only do I love that, Mindy, if I can share, I'm going to try to share something, because I had this thought too, and I put together a draft. And let me just see if I can. No, only it says only the host can do that. I don't know if. Let me text.
What do you want me to do,
Oh,
Ann?
there, you heard.
He's the-
Is it possible to enable me to share a document?
Oh, of course. Of course.
Great,
Bear with me for a moment. I was just, I'm here. I was having lunch, late lunch.
great.
Come on. Where are you, Ann?
I felt you listening.
Yeah, I was eavesdropping, but why can't I find her name? Here
Oh,
we go.
there we go.
Okay, I'm gonna make you co-host, Ann.
Great, thank you.
And you need to confirm.
Um, okay, hold
Okay.
on.
And then share your screen.
Uh, okay. Um, okay, let's see. I've never seen this before.
Okay. I think it should ask you if you want to confirm being co-host.
It did not, which
Okay.
is
Can you go to the bottom of your screen and see the share button, the arrow up?
okay. Somehow I just completely lost. You're still there because I can hear you, but I can't figure out why I have.
Take
Okay.
your just
There we go. Oh, no, I'm completely, what's going on here? I've never seen anything like this before.
Okay.
Here we go. Is that taking me back? Nope.
Do you
Nope.
want me to share a screen? Say something.
It maybe it's easier, but there we go. Okay, no, it just says, hold on. No, it doesn't say anywhere about accepting co-host, which
Okay. All right, then just go ahead and share your screen if that's what you want to do.
I was just gonna, let me see if I can send you a document
Mm-hmm.
and then if you can share it, if that's okay.
Sure.
Um, okay, I just sent it to
Okay.
you. Sorry, folks. It's just a Word doc.
Got it. Okay. Scan in progress.
So basically, what this was actually something I created a number of years ago for my agency because we were doing a lot of community engagement, and it was kind of a quick reference guide to myths, to what are various, what is trauma-informed care, what is housing first, all of those things. And I thought that this might be something useful for the commission, but also for our city councilors and potentially others. I know that my staff and board loved having kind of it was literally called it a pocket guide to homelessness.
There we go. Come on.
There's a part of me, Anna, who wants to sit back and hear what you've done that's already been done and succeeded with.
I mean, again, I did a lot of community engagement, podcast, regular media articles. It's one of the things I was thinking it'd be great to get like public media on site. Could we do a regular series? Not necessarily us. Again, we could bring people from different agencies, local across the country, researchers, etc. But the news articles were really helpful. We did a bi-weekly column, and it's often simple questions. Are homeless people all from somewhere else? One of the most popular ones is, should I give to someone who's asking for money? Does it all go to drugs and alcohol? Those kinds of things. And that really, one of the things I remember doing some research on was basically does, if you give money to people who are experiencing homelessness, do they just buy drugs and alcohol? So I did some research and found out that a person living on the streets eats an average of 2 meals a week. So I said, a lot of the money goes to food. But okay, so this is thank you, a pocket
Mhm.
guide talking about homelessness. So basically, I kind of did a draft for us. So who are we? Priorities. Then talk about some facts about Tucson and Pima County, just so people know. What are the statistics? Who are the population groups? And, how many youth are there experiencing homelessness? Causes, again, lack of affordable housing, et cetera. You'll see here. One of the things we did, which we differentiated, and it really made sense to a lot of people, was the causes versus the factors that make people more vulnerable to homelessness. So absolutely, mental illness, mental health issues, behavioral health issues, physical, all of these things, lack of job, domestic violence, are going to make you more vulnerable, but they don't cause homelessness. Just like I use the example, if you're over 65 and have diabetes, you're more vulnerable to getting COVID, but they don't cause COVID, right? So that was, I think, something that helped with a lot of people. Then, what are the research based? Neto, could you scroll up a little bit? And then again, understanding what is harm reduction, housing, and we can add to this. This was just a draft. Then what are the common myths? And what can you do to help? And we actually had very short, we didn't go into pages on stuff. It was just really simple things that kind of resonated with people. We provided this to, I had over 300 staff. They all got it. Our board got it. We started having requests from other agencies, some of our local elected officials. This was really helpful for them. So
Can that be put in the chat so I can print it out?
or I can send it to everybody afterward too. Whatever's easiest.
I didn't teach myself how to do Google Drive yet.
Yeah,
Oh,
just send a document.
I didn't do it on Google Drive. I just emailed it. I got lazy.
I'm supposed to learn how to do it.
I don't know. This might be something, this could be a project that we take on that could be pretty easy to put together. I don't know what people feel about that. It could be a start.
Yeah,
I love it. And
So go ahead.
It can be if it can be formatted into like a flyer or a mailable document, something that can be mailed, something that can be handed out, something, I'd love it even more. This is fantastic.
So I tell you what, why don't I can go ahead and send this to the whole committee and ask people to make any edits, or I will do this in a Google Doc. And Mindy, I am happy to come over and show you how to use Google Docs if that helps. Not that I'm an expert at it, but I use it quite a bit. And then people can, make any suggestions about changes or additions, and we can put this together. This could be our first deliverable. I think it would be great if we could provide this to City Council. This is where we could coordinate with the other committee to say, is there anything you would like to add in there about affordable housing that would be helpful? But this gives a guide, and we could also include with this like a resource guide. I'm sure that already exists. Don't want to make it too long because you want it to be, a quick at a glance kind of thing. So why don't I do that? Let's send this to the rest of the committee. I'll ask for any edits or comments by a certain date, and then I can put it together and we can approve it or not at our next meeting, and then see about getting that out. So that could be our first task to accomplish pretty quickly, I think.
Yeah, I like the idea a lot. I've seen the the directory of resources and providers too that the city and staff are often sharing. And this to me feels like kind of a like a companion to that, right? A little bit of the human touch that could go along with it, be distributed in a similar way. And it reminded me of, and maybe I can type the link here. Um, this neighborhood safety guide, Just Communities put out. I think this is a little more general and just like kind of engaging with your neighborhood, and
Mhm.
kind of feeling comfortable doing that. But when I first saw this, I was like, oh, this is a really great resource because it really shows, um, you know, just me, person in the neighborhood, like, okay, what are some ways I can add to this, um, community within my neighborhood?
I
Um,
I I love that. I think if they're okay with us using it, again, this is the advocacy side of how do we get people to change their minds, change their behavior, start building understanding. So, just communities to see if they would. I'm assuming they don't mind if we use it as long as we give them credit, but we can check for sure.
yeah. And with this, I'm kind of imagining, I don't know if you're familiar with zines, like, they're kind of a little more low tech. You cut them and fold them. Um, and part of the spirit of those too is, people add a little bit of a section, right? Here's a piece. And
Mhm.
as we're talking to different folks and groups too, just like with the myth busting kind of approach, what are some of the ways that you might, speak back against some of these, um, more damaging narratives? We could ask for like a contribution, like what are a few key points that you would want people to be doing or be aware of too?
Yeah, I think that's great. I mean, I think maybe doing a draft of some of this and asking a few people to take a look at it and um, to um,
I think we still do see your screen.
is that there we okay,
Yeah.
there we go. I think you've seen it, but get some community feedback on that. And what are some things are we missing? Again, without it becoming a encyclopedia. Remember encyclopedias? Um, uh, aging myself there. Um, so that would be a good, I think that's a good community engagement side of things, right? We've talked, right, really trying to engage with the community. So I will get this out in the next, because I'm away, I'm kind of a little bit um, traveling right now, but as soon as I get back, I will send it out to the full committee and ask for any feedback. What do you think about? Well, we have our meeting next week, I believe, or is it 2 weeks? I can't remember.
Yeah.
And I can speak to Jay about maybe um, putting this on the agenda for the full committee, for the full commission to take a look at, and if they have any ideas or suggestions, it might be a good way. Again, it would be great if we could bring in some of the affordable housing piece to this, not just the homelessness piece, but because that is one of the major solutions to homelessness is housing people can afford. Okay,
And
go ahead.
just want to make sure I'm understanding that kind of the approach too. So kind of workshopping the outline first as we start to kind of pull together pieces and talk to folks, and agenda, putting on the agenda just an outline. What's this as a framework to start pulling together
Yeah.
things? Okay.
Again, because I think our role is as community engagement, the more we can get people engaged in the
Yeah.
process, I think it's going to be more effective and more usable. Um, So I'll send it out for comments, edits from our committee. I'll talk to Jay or Neto is here. I don't know. You have You've already done the
No,
meeting?
we
No,
have.
you have. Is that something you could mention, or do you want me to reach out?
I certainly can mention it. This course could fall under your report out.
Okay.
There's a
Mhm.
section for you to report out, and you can bring this up. Or I can put it, as an agenda item. But
I'm okay either way. If you, when you have your meeting today, mention it, and if they
yep,
prefer, we just do it in the report out, no problem.
we'll do.
Oh,
Great.
and I guess I have a question for Neto
Yeah.
too. Do you know if there's a digital version of the kind of the fold out card that often gets distributed?
What card specifically are you talking about, Kenny?
I
Just.
think it's like a list of the various shelters
Oh,
and service
yes, yes.
providers.
I'm sure it exists somewhere. We didn't produce it, we being our space team.
Right.
I think Housing First produced it, but I'll ask around.
Okay.
Uh-huh.
Yeah, that'd be great to kind of look at side by side too.
Okay.
Yeah, thanks.
Right. Great. All right. So that's one item, sort of task number one that we'll be doing as a committee, which I think is great. Again, the other piece I'm wondering about is just some initial conversation. I'm just looking at our time here. We're good. Some initial conversations with some other organizations around engaging with community around community understanding. Is there opportunities for collaboration? Again, I know there's a lot of collaboration around the service side. I'm thinking more around the community education side. And again, another conversation with both the city and the county on somebody had mentioned the idea of a campaign, and it kind of slips my mind if that was Anne, um, or where that was coming. Do you remember?
HCD is talking about space, is talking about an affordable housing public
Okay.
education campaign. We haven't even started, yeah, but that has been the general discussion, affordable housing.
Okay. Because that would be something we'd want to make sure we don't want to have overlapping things that
Right.
is too much. So
Mhm.
I think that would be good. Um, I believe in the documentation I sent, I kind of listed organizations in Tucson that are working on this. How do folks feel about doing some outreach around the understanding myths, et cetera, and just gather some information and find out what is the temperature on the part of people to kind of look at a focus on this community wide? Just sort of initial conversations.
I think people who are involved in providing services are possibly already educated
No,
about.
I'm not talking about educating them. I'm talking about educating the broader community using their expertise or just collaborating.
I misunderstood.
Yeah, sorry. No, I don't think we need to educate them if they know they're the ones that know it. It's more building community, broader community understanding. There's sort of general public, and then there are key target groups. Like I mentioned, the chambers. I had a 2-hour conversation with the Hispanic chamber, and they were so receptive when we started talking about some of the myths and what is effective. And I think those kinds of conversations. So there's two. There's talking to the experts that are working in this area. Is this something that would be helpful to them? Would they like to be involved in some way that isn't creating a lot of resource heavy work for them? And then the other piece is talking to community groups to say, would you be interested in finding out more?
Like Rotary Club, Lions Club,
Exactly. All of those
faith-based places.
100%. And could we do a bit of a speaker series going around and talking to some of those groups? So how about we do this? We have kind of a list of agencies, so people working in this area. And I took special note, but behavioral health, I think that's really important. Police, people who are sort of frontline. I wonder if, and again, I can do a Google Doc, asking people what are some other groups we would like to target. Target, that's a horrible word. Like you just mentioned, Rotaries, Lions, Chambers, those kind of groups. And start putting together a priority list and start doing a little bit of outreach.
Neighborhood associations.
Neighborhood, that's right. Very important one. I'm assuming there's a list. Nato, is that something the city has a list of all the neighborhood associations?
Oh, yeah.
And people who, okay, so we could get that. It's probably posted somewhere, I'm assuming.
Yeah.
Okay.
Yeah.
And then, so we have 2 tasks right now, talking to folks in the community, sort of just a temperature check, getting feedback, ideas, put together this snapshot guide.
Are you thinking that we would go to speak to some of these groups, or have people who are providing these services talk to these groups?
That's a good question. I would say that we would have to have clear, agreed upon messaging as we're talking to these groups. So my preference to begin with would be for any commissioner who's willing and interested in doing that. And again, I still think we need to sort of agree on what are the things we're asking, what is it we're looking for, be very clear. Now, if people are not comfortable with that, that is totally fine. I mean, this has been my life. I'm happy to do that kind of thing. I've done a lot of it. I'm sure there are other people on the commission who also are really good at that and have connections. That could be something we could ask and figure out how to divide that up.
Doesn't hurt to ask.
That's right. I know some people don't like doing that, and that's totally valid. We'll make them do other things. So we've got 2 tasks. We still need some further information. Again, we can put this out to the full committee. We can bring it up at the commission meeting, the next commission meeting, and ask who's interested there. And again, wanting to make sure we're involving the affordable housing side of things in whatever we do in whatever way we can. And let me just double check my agenda. I don't want to, sorry, I feel like I'm absolutely dominating here. So please throw in any.
And we're absorbing and listening. This isn't there for myself.
Thank you. Oh, I know one other specific thing we had talked about, and I think this would be something to start thinking about and getting on our calendar. We had talked about speakers and bringing in people, and one of my thoughts was doing kind of a list and alternating between local and state or national. So we bring in experts here, things we'd like to hear more information about that, maybe stuff we don't know. And then again, who are some of the national experts that we could talk to or have them talk to us about some of the things that are going on. I'd love to bring in someone from the National Alliance to End Homelessness because they are the hub of all things homelessness in the country. I have some really good connections at all of these places, fortunately.
Would these be speakers who would come to the full commission?
That is something that I'd like to talk to Jay about because in some cases it might just be our committee, but if we're getting someone who's a national expert, I think it would be great to have it at the commission. That's just my opinion.
Okay.
Because I know there used to be a lot of speakers, so I don't want to duplicate.
You wouldn't be. The speakers that I think that you may have heard about would, and I hope I'm not insulting anyone, but they would come to the commission with a PowerPoint and then read the PowerPoint to us as the presentation. And we'd have a number of those. And my neurodivergency doesn't work well with trying to read and listen at the same time. So
Yeah.
I was a little outspoken about most of our commission time was taken up by the presentations. So that's shifted.
Right.
So
No, I agree. That's really frustrating. When I was in the commission in Pasadena, we had a very strict time limit for any speakers that could come. I think it was 15 minutes, and then we would allow 5 minutes for questions. But yeah, oh, can people still hear and see me?
Yes.
Okay, I just got a note that said rejoin the meeting. So I was like, did I get kicked out? It would be interesting again. I wish everybody were here because I'd love to have people start throwing out names. One of the things I would love to do, I'm sure it's been done, but I think it's really important, is to bring people in with lived experience. And I have an excellent colleague, friend, who was experienced homelessness, was a 25-year heroin addict, turned his life around, and he's now VP of advocacy for the agency I worked for and community engagement. And he knows, he is just a beautiful speaker. Someone like him, I think, would be great because he's been there. He was a outreach worker for many years, and then he got into the advocacy piece, but somebody like that. That's great. That's great. I think that's true. So again, just making notes for myself.
Neto just sent in the chat that HCD
Yes, that would be great to have someone local. Would be.
I know a number of people who have lived experience on the end of homelessness and mental illness.
Great. Yes, I think, okay, that'll be my third Google Doc is suggested speakers. And then we can coordinate with Jay around where is it going to be appropriate. I don't know if you've ever had anybody from the National Low Income Housing Coalition. They're amazing around the affordable housing side of things. They would be great to bring into, I think, for the full commission. Again, some of the national speakers I think would be, but I'll start a Google Doc and start, I'll put down a few ideas I have and then ask people to add. And then we can develop a calendar and working with Jay decide full commission. Is it just our committee?
I'm going to text my neighbor and ask him if he can come over and help me do a Google Drive.
Oh, good. It's super easy to get them. If you're getting to more complicated stuff, it can be a bit of a pain, but
I went to watch some YouTube videos and got lost.
I know. I'm like that too. Yeah. Okay. So how are we doing time-wise? Oh, we're doing good. Let's see here. Make sure I kind of completely went off the agenda, folks. I am sorry. So right now we have community guide, or whatever we want to call it, at a glance. We have speakers list. We have conversations. Then we have the idea of a calendar of events that we would kind of figure out who can be a representative. Nato, can I ask a procedural question? If we speak at council, say if there's a vote coming up or whatever, can we speak as a commissioner Or is that something that has to go through the full commission? We can only speak as a private individual, although saying that we are also, I'm just wondering how we do that.
I believe you'd have to go through the commission first to get
Okay.
approval. But I believe any citizen can go to the council and speak to the council. You could go to the council one day and say, I'm Ann Miskey. I'm speaking as a private resident. But for full disclosure, I happen to be on the commission, but I'm not speaking on behalf of the commission.
Okay,
Something like that.
great.
But to be official representative of the commission would have to get authorization.
Okay, that's great. Thank you. I kind of figured that's the way it was, but
Mhm.
I wanted to be really clear so we're not stepping where we shouldn't be. So I think we have sort of 4 key tasks on the plate. Now, we haven't talked about sort of, like I said, specific myths. We also talked about the population piece. Any concerns about that, or do we feel we can incorporate that into one of these 4 tasks that we've talked about?
I want to make sure my tasks are the same ones that you're thinking of.
Yep. Claire, what?
So I have community education,
Mhm.
one, advocacy, and suggested speakers.
Yeah, so the community education one has 2 parts to it. The guide
Mhm.
and the community conversations, we're going to be identifying places and having those conversations, developing messaging. So if different people are going out, it's the same messaging. So that's the community education piece. Then we have the speakers list, which would be either our committee or full commission. So it's really educating us, learning what's going on. And then the
Advocacy.
calendaring, which is really us being a representative out in the community, either of the commission or, as Neto just said, as private individuals, but based on kind of what we're learning and doing in the committee. Does that sound on target?
This one. I have one advocacy also.
Oh, that's right. So let's talk a little bit about advocacy. I mean, I'm a huge believer that it's vitally important. Is it something we take on separately, or do we incorporate it in the, say, the community education piece? And also the speakers, because we could bring in advocacy organizations who are working, like the National Low Income Housing Coalition is a perfect example. They are an advocacy organization for affordable housing, national.
I think that they come under speakers or presentations. But I defer to you, Anne.
No, please, even though I talk so much, I absolutely value other people's thoughts. And I know I feel badly because I've lived this for so many years that I can kind of
Mhm.
bulldoze, and I don't want to.
Wouldn't you think, I would think that all the work that you're doing, that you're suggesting, you're planning, implies advocacy. It
Yes.
incorporates advocacy without saying we're advocating. There is that feel, right? That
Yes.
vibe of that you're advocating.
I agree. I think there's advocacy and then there's policy more specific. And I don't know if we're really talking policy so much as advocating more
Advocating. Mhm.
for understanding of the causes and the solutions.
Yeah, that's how I see it as an outsider.
Yeah. No, thank you. I think that's an important clarification. Does that feel okay for you or Mindy or Kenny, or are you feeling like you want to get into more specific? Again, I call it sort of the policy versus general advocacy.
I think that sounds like a great starting point. Just super clear of the different parts we're tackling.
Kenny, is there something that you have an idea about that would fit into this process at this point?
No, I think it's a great outline. Looking forward to some of the smaller conversations and talking about this outline for the guide essentially. Um, uh, yeah, it again it makes me think of like a zine or something. We could get these different contributions to it, and then it starts to we might be organizing or leading parts of it, but it's really gathering a lot of different voices and demonstrating like, okay, there's a fair amount of people thinking and caring about the issue.
Yeah, I love that. I do have a question on the sort of policy advocacy piece, in that, is there a role, would it be appropriate for us to, as an advisor, and again, understanding this has to go through the full commission, but advising our city councilors on some of the major policy issues that are happening around this issue? So it's truly an advisory to the city council role, where we're saying, here are some policies that are being enacted or being put forward at the national or state level, and doing maybe a little bit of analysis of, what does this mean that might help some of the decisions locally. Is that an appropriate role? Is that something we think we could take on?
I think that might need to go to the full commission.
100%, 100%. But even before we sort of dive into it, I think that could be something we bring up at the meeting. The
Recommendation.
report back's going to be really long, Nathan. It's hard to track, and counselors have a zillion things on their plates that they're dealing with, and I just wondered if it might be helpful, and we can bring it up at the commission to say, could we put out a bi-monthly, this is what's going on, like a one pager, and if you want more information, here's a link, or we're happy to talk to you. But they may already be there. I don't want to presume that they're not already fully conversant with this issue. Should we bring it up at the commission and just see what people think?
Yes.
Okay.
I'm knowing a few of the members on the commission. Some of them are very well versed in these issues. I can't speak for all of them.
100%. A lot of them, deal with this daily, right? They're working in the field, so, and in the advocacy side of things. All right. Anything else that we have missed? I think we've covered everything specifically on the agenda. But
one last thing, if the document that you had put up before, can you put that in the chat?
I think I'll have to have Neto do it, because I can't. No, I can actually, can't I, when I chat? Sorry.
Yeah, you want it in chat, or we can just send it out email.
Yeah.
Email would be great.
Email's
I
easier.
don't have Google Drive yet.
Okay, I'll email. Yeah, I did not email that with everything else, so I will definitely do that. I already inundated you with so much.
We love it.
That I
don't feel inundated, Anne.
Okay, good.
I feel like what I feel about you in this meeting is that you are coming with a lifetime of experience, specifically on this topic that we are wanting to tackle, and how blessed we are that you have joined the commission with your knowledge base and passion. So
thank you. I appreciate that. Very much so. But please don't ever hesitate anybody to say, Anne, be quiet. Let us talk. My staff used to do that to me all the time, so I'm used to it. All right. Anything else last from you, Kenny? No, we're
Uh,
good.
Yeah, just second that. Thanks for really taking the helm.
Yes.
Oh, you are welcome. And I will try to get everything out early next week, like I say, the next few days, because I'm in transit. But I've written down everything here that I have to do, and I'll get it out. If you have any other thoughts or ideas, always feel free to email me. I will email that guide as soon as we're done here. And I think if there's nothing else, fun. Oh yes, Neto.
Um, and I'll send you an email, but I'm going to be out for the next 2 weeks.
Oh, that's
So
right.
any correspondence will go to Lena Porrell, my supervisor. But I'll
Okay.
send you an email. I won't be present, obviously, at the next week's meeting,
Okay.
or in the next subcommittee meeting, the innovation. So anyway, I'm out, and but
That's
we'll continue.
that's wonderful. Well, have a big jug of sangria for me.
I will.
Oh,
Paella, all the good stuff.
Oh, definitely will.
Have a great.
Lots of it too.
Great.
Hmm.
Well, thank you, everybody. Again, Naito, thank you for all you do, coordinate, and
Yeah,
especially with how zoomed out I've been over the last few weeks. I appreciate your
yeah.
patience with
No, you're
me.
good. You're good.
And thank you, Mindy and Kenny. And we will see you at the commission meeting, but I will get that material out to you. Yes.
No, I'm
Safe
just saying
travels.
bye. Thank you, Kenny. Be
Excellent.
well. Bye, Mindy.
I thank you,
Okay.
everyone.
Have a great day, everybody.
Bye.
This was a
Take care.
wonderful meeting. Thank you.